Medical Assistant Exam Billing and Coding Review. Question 1. In a patient intake station, a capillary puncture is needed on an adult finger. Which side is generally preferred? Option A. The tip of the index finger. Option B. The side of the middle or ring finger pad. Option C. The little finger near the bone. Option D. The center of the thumb pad. The correct answer is option B. The side of the middle or ring finger pad. The lateral side of the middle or ring finger pad helps avoid bone and sensitive central tissue. The index finger is commonly used for touch and may be more sensitive or calloused. The little finger has less tissue over bone and is usually avoided. The thumb is often calloused and has a pulse, making it less preferred. Question 2. After reviewing the situation in a medication administration visit, a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A. Tell the patient to send an email later. Option B. Follow emergency triage protocol immediately. Option C. Schedule the patient for next month. Option D. Give a diagnosis over the phone. The correct answer is option B. Follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Potential emergencies require immediate action. Routine scheduling can delay care for potentially serious symptoms. Medical assistants should not diagnose the cause of symptoms. Question 3. An office review in a pediatric clinic shows that a subcutaneous injection is ordered. Which site is commonly appropriate? Option A. Abdomen with adequate subcutaneous tissue. Option B. Directly into a vein. Option C. Into an area that is bruised and inflamed. Option D. Deep into the deltoid muscle only. The correct answer is option A. Abdomen with adequate subcutaneous tissue. Subcutaneous injections are placed into fatty tissue, and the abdomen is a common site when appropriate. Intravenous administration is a different route and is outside a subcutaneous injection. Bruised or inflamed tissue should generally be avoided. The deltoid muscle is an intramuscular site, not a routine subcutaneous site. Question 4. The care team in an electronic health record review asks for guidance because the assistant needs to keep provider meeting time unavailable for patient appointments. Which scheduling tool is useful? Option A. Order of draw. Option B. Sterile field setup. Option C. Coinsurance posting. Option D. Matrix blocking. The correct answer is option D. Matrix blocking. Matrix blocking reserves time in the schedule for meetings, procedures, or other unavailable periods. Order of draw guides blood collection sequence. Sterile field setup supports clinical procedures, not schedule blocking. Coinsurance posting relates to patient financial responsibility. Question 5. When a patient encounter unfolds in a pediatric clinic, a patient from a different cultural background describes a health practice unfamiliar to the assistant. Which response is most appropriate? Option A. Tell the patient the practice is foolish. Option B. Refuse to document relevant information. Option C. Assume all people from that culture act the same. Option D. Ask respectful questions and avoid judgment. The correct answer is option D. Ask respectful questions and avoid judgment. Culturally sensitive communication explores patient beliefs while maintaining respect. Judgmental language damages trust and may prevent disclosure. Relevant patient information should be documented according to policy. Stereotyping ignores individual differences. Question 6. At the start of care in a certification exam scenario, the prefix hypo appears in a term such as hypoglycemia. Which meaning is correct? Option A. Below normal or deficient. Option B. Before. Option C. Against. Option D. Above normal. The correct answer is option A. Below normal or deficient. Hypo means below normal or deficient, as in low blood glucose. Before is indicated by pre. Against is indicated by anti. Above normal is indicated by hyper. Question 7. Given the workflow in a clinical skills review, a disinfectant label lists a 10-minute wet contact time. Which action is necessary? Option A. Use the disinfectant only on clean hands. Option B. Wipe the surface dry immediately. Option C. Keep the surface wet for the full listed contact time. Option D. Dilute the solution more to reduce odor. The correct answer is option C. Keep the surface wet for the full listed contact time. Disinfectants need the manufacturer's required contact time to achieve the intended level of microbial kill. Environmental disinfectants are not hand hygiene products. Removing the disinfectant too soon can make it ineffective. Unapproved dilution can reduce disinfectant strength. Question 8. The care team in a specialty referral visit asks for guidance because a patient arrives for a routine visit and appears anxious about the first blood pressure reading. Which communication technique should the medical assistant use? Option A. Promise that the provider will not be concerned. Option B. Tell the patient the reading is probably wrong. Option C. Acknowledge the concern and explain the procedure in simple terms. Option D. Ignore the anxiety to avoid making it worse. The correct answer is option C. Acknowledge the concern and explain the procedure in simple terms. Acknowledging emotion and explaining the task supports trust while keeping the patient informed. Promising an outcome goes beyond the assistant role and may be inaccurate. Dismissing the result can reduce confidence and may be clinically misleading. Ignoring patient concerns can increase anxiety and weaken communication. Question 9. In an electronic health record review, a patient arrives at check-in and the waiting room can overhear the conversation. Which practice protects privacy? Option A. Ask other patients to help verify the record. Option B. Speak quietly and avoid announcing sensitive details. Option C. Place all charts open on the counter. Option D. State the full diagnosis loudly to confirm the visit. The correct answer is option B. Speak quietly and avoid announcing sensitive details. Front office privacy requires limiting unnecessary disclosure where others may overhear. Other patients should not be involved in private verification. Open charts may expose protected information. Announcing diagnoses in public can violate confidentiality. Question 10. Before the visit continues in a diagnostic testing area, a patient receives a document explaining what the insurer paid and what may be owed. Which document is this? Option A. Advance Directive. Option B. Progress Note. Option C. Explanation of benefits. Option D. Sterilization log. The correct answer is option C. Explanation of benefits. An explanation of benefits summarizes payer processing, allowed amounts, payments, and patient responsibility. An advance directive communicates future care wishes, not payment information. A progress note documents clinical care, not insurance payment decisions. A sterilization log tracks instrument processing, not claim payment. Question 11. For a patient encounter in a walk-in clinic, a mistake is found in an electronic progress note after it was signed. Which correction method is appropriate? Option A. Make an addendum according to office policy. Option B. Ask a coworker to change it under their login. Option C. Delete the original note completely. Option D. Ignore the error even if it affects care. The correct answer is option A. Make an addendum according to office policy. An addendum preserves the original entry while documenting the correction transparently. Using another person's login violates accountability. Deleting a signed record can destroy the audit trail. Clinically important errors should be corrected through proper procedures. Question 12. During an outpatient laboratory, a manual blood pressure cuff is too small for the patient's arm. Which result is most likely? Option A. The pulse oximetry reading will be inaccurate. Option B. The blood pressure may read falsely low. Option C. The blood pressure may read falsely high. Option D. The temperature will be elevated. The correct answer is option C. The blood pressure may read falsely high. A cuff that is too small can overestimate blood pressure because pressure is applied over too narrow an area. Cuff size does not directly determine oxygen saturation accuracy. A cuff that is too large is more likely to produce a falsely low reading. Cuff size has no direct effect on body temperature. Question 13. While working in a medical office workflow, a provider documents a vaccine administration. Which coding information may be needed for billing? Option A. Only the patient's favorite color. Option B. Only the assistant's initials with no service information. Option C. Procedure code and diagnosis or reason for the service. Option D. Only the room number. The correct answer is option C. Procedure code and diagnosis or reason for the service. Claims often require a service code and a diagnosis or reason to support medical necessity. Personal preferences do not support claim coding. Initials alone do not provide billing codes or medical necessity. Room numbers do not describe the service or diagnosis. Question 14. At the start of care in an internal medicine office, the provider discusses the function of white blood cells. Which role is most accurate? Option A. Produce insulin in the pancreas. Option B. Help defend against infection. Option C. Store bile for digestion. Option D. Carry oxygen as their primary job. The correct answer is option B. Help defend against infection. White blood cells are immune cells that help protect the body from infection. Insulin production occurs in pancreatic beta cells, not white blood cells. Bile storage is a gallbladder function. Oxygen transport is mainly the role of red blood cells. Question 15. Given the workflow in a procedure setup, a patient is left without follow-up after the provider terminates care without proper notice. Which legal issue is most likely? Option A. Assault. Option B. Beneficence. Option C. Coinsurance. Option D. Abandonment. The correct answer is option D. Abandonment. Abandonment occurs when care is ended without proper notice or an opportunity to obtain continuing care. Assault is a threat or fear of unwanted touching, not failure to provide follow-up. Beneficence means acting for the patient's good. Coinsurance is a payment-sharing insurance term. Question 16. At the start of care in an outpatient laboratory, a claim requires the code that explains why a service was performed. Which code set is used? Option A. CPT. Option B. NDC only. Option C. ICD-10-CM. Option D. Place of service only. The correct answer is option C. ICD-10-CM. ICD-10-CM codes report diagnoses and reasons for services. CPT codes report procedures and services rather than diagnoses. National drug codes identify medications and do not describe diagnoses. Place of service identifies setting, not the medical reason for care. Question 17. Given the workflow in a patient education session, a specimen must be protected from light after collection. Which handling method is appropriate? Option A. Leave the specimen uncovered at the front desk. Option B. Shake the specimen vigorously for 1 minute. Option C. Wrap the specimen in foil or use an amber container as directed. Option D. Place the tube in direct sunlight to warm it. The correct answer is option C. Wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Delayed or improper handling can compromise results. Vigorous shaking can hemolyze blood specimens. Sunlight can degrade light-sensitive specimens. Question 18. During a community health clinic, a medication order is present but the patient reports an allergy to the drug. Which action should occur before administration? Option A. Change the medication to another drug independently. Option B. Administer the medication because it was ordered. Option C. Ask the patient to sign a form and give it anyway. Option D. Hold the medication and notify the provider. The correct answer is option D. Hold the medication and notify the provider. A reported allergy is a safety concern that must be clarified before giving the medication. Medical assistants do not independently substitute medications. An order does not override a possible allergy. A form does not make an unsafe medication appropriate. Question 19. After reviewing the situation in a treatment room, the term dermatology appears in a referral. Which specialty is involved? Option A. Skin. Option B. Heart. Option C. The blood. Option D. Kidney. The correct answer is option A. Skin. Dermatology is the specialty focused on skin conditions. Cardiology focuses on the heart. Hematology focuses on blood and blood disorders. Nephrology focuses on the kidneys. Question 20. Before the visit continues in an electronic health record review, the office wants to place 2 short follow-up visits in the same time slot according to policy. Which scheduling method is being used? Option A. Double booking. Option B. Clustering. Option C. Open hours. Option D. Wave scheduling. The correct answer is option A. Double booking. Double booking places more than one patient in the same appointment slot. Clustering groups similar types of appointments together. Open hours allow patients to arrive without exact appointment times. Wave scheduling schedules several patients to arrive at the beginning of a block. Question 21. While working in a community health clinic, an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A, recheck using proper technique and report the finding according to protocol. Option B, erase the value because it may worry the patient. Option C, send the patient home to rest without notifying anyone. Option D, tell the patient that hypertension has been diagnosed. The correct answer is option A. Recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Accurate documentation is required even when the value is abnormal. Abnormal readings require appropriate follow-up rather than dismissal. Medical assistants do not diagnose conditions based on one reading. Question 22. Following office protocol in a treatment room, the assistant is comparing two needle gauges. Which statement is accurate? Option A, gauge has no relation to needle size. Option B, a smaller gauge number indicates a larger needle diameter. Option C, a larger gauge number always means a longer needle. Option D, all injections use the same gauge. The correct answer is option B, a smaller gauge number indicates a larger needle diameter. Needle gauge numbers are inverse to diameter, so lower numbers are wider. Gauge specifically describes needle diameter. Gauge describes diameter, not length. Needle gauge varies by medication, route, and patient factors. Question 23. After reviewing the situation in a busy front office, a claim is denied because patient insurance information was outdated. Which front office process helps prevent this issue? Option A, verify insurance eligibility at each visit according to policy. Option B, skip registration for returning patients forever. Option C, use the oldest card in the file without asking. Option D, code every visit as preventive care. The correct answer is option A, verify insurance eligibility at each visit according to policy. Eligibility verification helps identify coverage changes before claims are submitted. Returning patients can have changed insurance or contact information. Old cards may no longer reflect active coverage. Coding must reflect the service and documentation. Question 24. Before the visit continues in a walk-in clinic, a mask becomes wet during patient care. Which action is appropriate? Option A, keep wearing it for the rest of the week. Option B, dry it on the clean supply shelf. Option C, replace the mask according to infection control practice. Option D, share it with a coworker. The correct answer is option C, replace the mask according to infection control practice. A wet mask is less effective and should be changed safely. Extended use of a wet mask is not appropriate. Used masks can contaminate clean areas. Masks are not shared between staff. Question 25. When a patient encounter unfolds in a community health clinic, a patient is scheduled for an electrocardiogram and asks whether it will shock them. Which response is accurate? Option A, the test records electrical activity and does not deliver a shock. Option B, the machine draws blood through the wires. Option C, the electrodes inject medication. Option D, the test shocks every patient to start the heart. The correct answer is option A, the test records electrical activity and does not deliver a shock. A standard electrocardiogram is a recording test, not a treatment shock. Electrocardiogram leads do not collect blood. Electrodes record signals and do not inject medication. A standard electrocardiogram does not deliver electrical therapy. Question 26. During an exam room, a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A, keeping sterile items above waist level. Option B, reaching across the sterile field with an unsterile sleeve. Option C, opening the wrapper away from the body first. Option D, using sterile forceps for sterile supplies. The correct answer is option B, reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Sterile items are generally kept in view and above waist level. Opening the far flap first is a common way to avoid reaching over the field. Sterile forceps can help maintain asepsis when used correctly. Question 27. As part of exam preparation in a primary care office, a patient appears to be choking but can cough forcefully. Which response is generally appropriate? Option A, encourage coughing and monitor closely. Option B, perform blind finger sweeps immediately. Option C, give the patient food to push it down. Option D, leave the patient alone until they stop coughing. The correct answer is option A. Encourage coughing and monitor closely. A forceful cough suggests partial airway obstruction, and coughing may clear it. Blind finger sweeps can push the object deeper and are not appropriate. Food can worsen the obstruction. The patient should be monitored because the obstruction may worsen. Question 28. To protect safety in an infection control audit, a glucose test requiring glycolysis inhibition is ordered. Which tube is commonly associated with this additive purpose? Option A, lavender tube. Option B, blood culture bottle. Option C, gray tube. Option D, light blue tube. The correct answer is option C, gray tube. Gray tubes commonly contain additives such as fluoride that help inhibit glycolysis for glucose testing. Lavender EDTA is used mainly for hematology testing. Blood culture bottles are used to detect bloodstream microorganisms. Light blue citrate is used for coagulation studies. Question 29. For a patient encounter in a patient intake station, a patient pays a fixed amount at the time of an office visit. Which insurance term applies? Option A, adjustment. Option B, copayment. Option C, premium. Option D, deductible. The correct answer is option B, copayment. A copayment is a fixed amount the patient pays for a covered service. An adjustment changes the billed amount based on contracts or corrections. A premium is the amount paid to maintain insurance coverage. A deductible is the amount the patient pays before insurance begins paying according to the plan. Question 30. After reviewing the situation in a women's health clinic, a patient asks the medical assistant to interpret laboratory results. Which response is within scope? Option A, diagnose the patient based on abnormal values. Option B, change the results so it appears normal. Option C, tell the patient the provider will review and explain the results. Option D, post the result publicly so others can comment. The correct answer is option C. Tell the patient the provider will review and explain the results. Interpreting results and giving diagnostic meaning are provider responsibilities. Diagnosis is outside the medical assistant's scope of practice. Changing results is unethical and falsifies the record. Public disclosure violates confidentiality and professionalism. Question 31. At the start of care in an internal medicine office, a complete blood count is ordered. Which tube is most commonly used? Option A, gray tube with fluoride oxalate. Option B, light blue tube with sodium citrate. Option C, lavender tube with EDTA. Option D, a red tube with no anticoagulant. The correct answer is option C, lavender tube with EDTA. A complete blood count requires anticoagulated whole blood, and EDTA in a lavender tube preserves cell morphology. Gray tubes are used for tests such as glucose or lactate depending on protocol. Sodium citrate is used mainly for coagulation studies. A red tube allows clotting and is not the standard choice for a complete blood count. Question 32. Before the visit continues in a family practice clinic, the date of birth in the chart does not match the date of birth stated by the patient. Which response best protects patient safety? Option A, correct the date of birth without asking anyone. Option B, use the appointment time as the identifier. Option C, stop and resolve the discrepancy before proceeding with care. Option D, continue if the last name matches. The correct answer is option C, stop and resolve the discrepancy before proceeding with care. A mismatch in identifiers must be clarified before treatment, specimen collection, or documentation continues. Changing demographic data without verification may create a documentation error. Appointment times are scheduling data and are not approved identifiers. A last name alone does not rule out an identity error. Question 33. Following office protocol in a family practice clinic, a coworker asks to view a neighbor's chart out of curiosity. Which response is appropriate? Option A, share the chart because staff work in the same clinic. Option B, print the chart and remove the patient's name only. Option C, open the chart if the coworker promises not to tell anyone. Option D, deny the request because there is no job-related need to know. The correct answer is option D, deny the request because there is no job-related need to know. Access to protected health information must be limited to legitimate work-related purposes. Employment at the same clinic does not automatically authorize chart access. De-identified information must meet specific standards and curiosity is not permitted access. A promise does not create a permitted reason for access. Question 34. An office review in an administrative check-in area shows that the endocrine system is being reviewed. Which gland produces thyroid hormone? Option A, gallbladder. Option B, urinary bladder. Option C, appendix. Option D, thyroid gland. The correct answer is option D, thyroid gland. The thyroid gland produces hormones that help regulate metabolism. The gallbladder stores bile and is not an endocrine gland producing thyroid hormone. The urinary bladder stores urine and does not produce thyroid hormone. The appendix does not produce thyroid hormone. Question 35. Before the visit continues in a treatment room, the assistant prepares the room for a minor sterile procedure. Which action supports patient dignity? Option A, discuss the patient's body in the hallway. Option B, skip explanations because the patient signed in. Option C, leave the patient uncovered until the provider arrives. Option D, provide appropriate draping and expose only the area being examined. The correct answer is option D, provide appropriate draping and expose only the area being examined. Draping preserves privacy and warmth while allowing the provider access to the needed area. Public discussion can violate privacy and professionalism. Patients still need respectful communication during preparation. Unnecessary exposure reduces dignity and comfort. Question 36. At the start of care in an exam room, the provider mentions the largest artery in the body. Which vessel is being described? Option A, pulmonary vein. Option B, aorta. Option C, vena cava. Option D, carotid vein. The correct answer is option B, aorta. The aorta is the main artery carrying blood from the left ventricle to systemic circulation. Pulmonary veins return blood from the lungs to the heart. The vena cava is a large vein returning blood to the heart. Carotid structures are in the neck, but the carotid artery is not the largest artery. Question 37. During a patient intake station, a pregnancy test performed in the office is classified as wave testing. Which requirement still applies? Option A, skip controls because waived means unregulated. Option B, use expired kits if the package is unopened. Option C, follow manufacturer instructions and quality control policy. Option D, report results before the test develops. The correct answer is option C, follow manufacturer instructions and quality control policy. Wave tests are simple, but they still require correct procedure, controls, and documentation. Waived status does not eliminate quality responsibilities. Expired test kits may give unreliable results. Reading before the correct time can produce inaccurate results. Question 38. To protect safety in an internal medicine office, an exam room was used for a patient with a draining wound. Which step should be completed before the next patient enters? Option A, change only the paper on the exam table. Option B, spray disinfectant and wipe it off immediately every time. Option C, open the door to air out the room only. Option D, clean and disinfect touched surfaces according to office protocol. The correct answer is option D, clean and disinfect touched surfaces according to office protocol. Environmental cleaning reduces the chance of transferring microorganisms between patients. The exam table paper does not address other touched surfaces. Disinfectants usually require the manufacturer's contact time to work properly. Ventilation alone does not remove organisms from contaminated surfaces. Question 39. During a community health clinic, a staff member shares an electronic health record password to save time. Which risk is created? Option A, automatic insurance approval. Option B, loss of accountability for chart access. Option C, improved privacy protection. Option D, better sterilization monitoring. The correct answer is option B, loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Passwords do not control payer authorization. Password sharing weakens privacy and security. Login credentials do not sterilize instruments. Question 40. After reviewing the situation in an urgent care office, the term gastroenterology appears in a referral. Which specialty is involved? Option A, urinary bladder only. Option B, endocrine glands. Option C, digestive system. Option D, nervous system. The correct answer is option C, digestive system. Gastroenterology focuses on the digestive tract and related disorders. Urology focuses on the urinary tract and male reproductive system. Endocrinology focuses on hormone-producing glands. Neurology focuses on the nervous system. Question 41. Given the workflow in a certification exam scenario, a medical office uses a policy and procedure manual. Which purpose is most accurate? Option A. Provide standardized guidance for office tasks. Option B. Replace all state laws. Option C. Guarantee every claim is paid. Option D. Eliminate the need for training. The correct answer is option A. Provide standardized guidance for office tasks. Policies and procedures help staff perform tasks consistently and safely. Office policy cannot override applicable law. Policies do not guarantee pay or reimbursement. Policies support but do not replace staff training. Question 42. For a patient encounter in an electronic health record review, a 24-hour urine collection begins at 8 a.m. Which instruction is correct? Option A. Discard the first void and collect all urine for the next 24 hours. Option B. Keep only the first void and discard the rest. Option C. Collect urine only when symptoms occur. Option D. Leave the container unrefrigerated unless it smells unusual. The correct answer is option A. Discard the first void and collect all urine for the next 24 hours. Discarding the first void establishes the start time, and all urine afterward is collected until the end time. A single first void is not a 24-hour collection. Timed urine testing requires all urine during the collection period. Storage requirements should follow the test protocol and preservative instructions. Question 43. The care team in a certification exam scenario asks for guidance because a medical assistant performs a procedure without patient permission. Which legal concern may apply? Option A. Defamation. Option B. Coordination of benefits. Option C. Battery. Option D. Emancipation. The correct answer is option C. Battery. Battery can involve intentional touching or treatment without consent. Defamation involves false statements that harm reputation. Coordination of benefits is an insurance concept. Emancipation relates to a minor's legal independence. Question 44. When a patient encounter unfolds in a family practice clinic, a patient is learning how to use a home blood pressure log. Which instruction improves reliability? Option A. Skip technique instructions because home cuffs are automatic. Option B. Use another person's readings if the cuff is shared. Option C. Write only the highest number ever measured. Option D. Record readings with date, time, and relevant notes as directed. The correct answer is option D. Record readings with date, time, and relevant notes as directed. A structured log helps the provider compare readings and context over time. Proper positioning and technique still matter with automatic cuffs. Readings must belong to the patient. Selective recording can mislead clinical decisions. Question 45. When a patient encounter unfolds in a patient education session, an assistant is unsure how to handle a chemical disinfectant spill. Which resource should be consulted? Option A. Safety data sheet. Option B. Insurance remittance advice. Option C. Patient intake form. Option D. Appointment reminder template. The correct answer is option A. Safety data sheet. The safety data sheet gives hazard, handling, storage, and spill response information for chemicals. Remittance advice explains payment decisions, not chemical hazards. An intake form does not provide chemical safety instructions. Reminder templates do not address workplace chemical safety. Question 46. Before the visit continues in a phlebotomy station, a patient falls in the exam room. Which action is best? Option A. Pull the patient up immediately. Option B. Call for help and assess for injury before moving the patient. Option C. Hide the incident if no one saw it. Option D. Tell the patient to drive home without evaluation. The correct answer is option B. Call for help and assess for injury before moving the patient. After a fall, unnecessary movement can worsen injury, so help and assessment come first. Moving the patient before assessment can worsen an injury. Falls must be reported and documented according to policy. The patient should be assessed before leaving. Question 47. The care team in a clinical skills review asks for guidance because a pulse oximeter is placed on a cold finger and the reading is inconsistent. Which action should be tried first? Option A. Warm the finger or choose a better perfused site. Option B. Ignore the waveform and record the lowest value. Option C. Place the probe over wet nail polish. Option D. Increase oxygen without reporting the finding. The correct answer is option A. Warm the finger or choose a better perfused site. Poor peripheral perfusion can make pulse oximetry readings unreliable. An unstable signal should be corrected before documenting the value. Moisture and polish can interfere with sensor performance. Medication or oxygen changes should follow provider direction and clinical protocol. Question 48. Before the visit continues in an outpatient laboratory, a sterile dressing change is being prepared. Which action helps maintain sterility? Option A. Reuse sterile gloves from a previous patient. Option B. Place sterile gauze on an unclean counter. Option C. Reach across the field with unsterile clothing. Option D. Open sterile supplies without touching the inner sterile surface. The correct answer is option D. Open sterile supplies without touching the inner sterile surface. Avoiding contact with sterile surfaces helps preserve the sterile field. Sterile gloves are single-use and patient-specific. An unclean surface contaminates sterile supplies. Reaching over the field can contaminate it. Question 49. After reviewing the situation in a preventive care visit, a pelvic examination is scheduled. Which patient position is commonly used? Option A. Lithotomy. Option B. Sims. Option C. Prone. Option D. Trendelenburg. The correct answer is option A. Lithotomy. The lithotomy position is commonly used for pelvic examinations. Sims position is often used for rectal procedures or enemas. Prone means lying face down and is not the common pelvic exam position. Trendelenburg places the head lower than the feet and is not the routine pelvic exam position. Question 50. The care team in an exam room asks for guidance because the provider asks for an instrument to examine the ear canal. Which instrument should be prepared? Option A. Ophthalmoscope. Option B. Spirometer. Option C. Speculum for pelvic exam. Option D. Otoscope. The correct answer is option D. Otoscope. An otoscope is used to inspect the ear canal and tympanic membrane. An ophthalmoscope is used to examine internal eye structures. A spirometer evaluates lung function rather than the ear. A vaginal speculum is not used to inspect the ear canal. Question 51. As part of exam preparation in a telephone triage workflow, a claim requires the code for an office visit procedure or service. Which code set is used? Option A. ICD-10-CM. Option B. CPT. Option C. Policy number. Option D. Zip code. The correct answer is option B. CPT. CPT codes describe medical procedures and professional services. ICD-10-CM codes describe diagnoses and reasons for services. A policy number identifies insurance coverage and does not describe the service. A zip code identifies location and is not a procedure code. Question 52. Before the visit continues in an electronic health record review, a provider orders a capillary blood glucose test. Which site preparation is important? Option A. Clean and dry the puncture site according to protocol. Option B. Puncture through visible dirt. Option C. Use the first visibly dirty drop for every test. Option D. Skip patient identification because the test is quick. The correct answer is option A. Clean and dry the puncture site according to protocol. Cleaning and drying the site reduces contamination and supports accurate capillary testing. Contamination can affect the sample and infection risk. Site contaminants can affect the first drop depending on protocol. Patient identification is required even for quick point-of-care tests. Question 53. For a patient encounter in an internal medicine office, the abbreviation PRN appears on a medication list. Which meaning should be recognized? Option A. Immediately. Option B. As needed. Option C. By mouth. Option D. Every morning. The correct answer is option B. As needed. PRN means the medication is taken as needed according to the order. Immediately is stat in common medical usage. By mouth is PA. Every morning is commonly abbreviated differently and is not PRN. Question 54. At the start of care in a phlebotomy station, a patient reports feeling dizzy after standing quickly. Which immediate action reduces fall risk? Option A. Tell the patient dizziness is impossible. Option B. Assist the patient to sit or lie down safely. Option C. Ask the patient to walk faster. Option D. Leave the patient standing while searching for forms. The correct answer is option B. Assist the patient to sit or lie down safely. Helping the patient into a safe position reduces the chance of injury from fainting or falling. Dismissing symptoms does not protect patient safety. Walking can increase fall risk when the patient is dizzy. An unsteady patient should not be left unsupported. Question 55. Before the visit continues in a specialty referral visit, a patient must pay a percentage of the allowed charge after the deductible is met. Which term applies? Option A, coinsurance. Option B, referral. Option C, copayment. Option D, a remittance address. The correct answer is option A, coinsurance. Coinsurance is the patient's percentage share of covered costs. A referral is permission or direction to see another provider. A copayment is usually a fixed amount rather than a percentage. A remittance address tells where payments or documents are sent. Question 56. After reviewing the situation in an infection control audit, the assistant uses a fire extinguisher on a small contained fire. Which acronym describes extinguisher use? Option A, HIPAA. Option B, ARICE. Option C, PERLA. Option D, PASS. The correct answer is option D, PASS. PASS stands for pull, aim, squeeze, and sweep. HIPAA governs health information privacy and security. RICE refers to rest, ice, compression, and elevation for certain injuries. PERLA describes pupil assessment. Question 57. Following office protocol in an administrative check-in area, a patient says they cannot afford a prescribed medication. Which response is best? Option A, tell the patient to stop all medications. Option B, ignore the comment because finances are private. Option C, suggest sharing medication with a friend. Option D, notify the provider or appropriate staff so alternatives can be discussed. The correct answer is option D, notify the provider or appropriate staff so alternatives can be discussed. Cost concerns affect adherence and should be routed to the care team for appropriate options. Stopping medication without provider guidance can be unsafe. The concern directly affects care and should be addressed respectfully. Sharing prescriptions is unsafe and inappropriate. Question 58. Before the visit continues in a patient intake station, office supplies are consistently running out before the next order date. Which administrative action is best? Option A, wait until every item is completely gone. Option B, order random supplies without reviewing use. Option C, track usage and adjust par levels according to office needs. Option D, hide supplies from the provider. The correct answer is option C, track usage and adjust par levels according to office needs. Inventory control uses usage patterns and reorder points to prevent shortages. Waiting can interrupt patient care and office workflow. Unplanned ordering can waste money and storage space. Hiding supplies does not solve inventory management. Question 59. When a patient encounter unfolds in a primary care office, a patient asks for a copy of their medical record. Which action should the assistant take? Option A, delete sensitive information before the request is reviewed. Option B, follow the office release of information process. Option C, give the record to anyone who asks. Option D, refuse because records belong only to the provider. The correct answer is option B, follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Altering the record is inappropriate and may violate legal requirements. Identity and authorization must be verified before disclosure. Patients have rights to access their health information under applicable rules. Question 60. When a patient encounter unfolds in a quality control review, a fax containing patient information must be sent to another facility. Which step reduces privacy risk? Option A, send it to a number from memory without checking. Option B, verify the recipient fax number before sending. Option C, leave the fax confirmation on a public counter. Option D, include unrelated patient charts in the same fax. The correct answer is option B, verify the recipient fax number before sending. Verifying the destination helps prevent disclosure to the wrong recipient. Memory errors can lead to misdirected protected information. Confirmation pages may contain protected information and should be handled securely. Only necessary information should be disclosed. Question 61. An office review in a same-day appointment shows that coordination of benefits is needed. Which situation does this usually involve? Option A, A provider orders a throat swab. Option B. A patient has one cash payment only. Option C. A patient has more than one insurance plan. Option D. A patient needs a sterile dressing. The correct answer is option C. A patient has more than one insurance plan. Coordination of benefits determines how multiple plans share payment responsibility. A throat swab order does not itself involve multiple insurance plans. One cash payment does not require multiple plan coordination. Dressing supplies do not create coordination of benefits by themselves. Question 62. Given the workflow in a pediatric clinic, an intradermal test is being prepared. Which description matches the route? Option A. Medication placed into the ear canal. Option B. Injection just under the epidermis to form a small wheal. Option C. Medication swallowed by mouth. Option D. Injection into deep muscle tissue. The correct answer is option B. Injection just under the epidermis to form a small wheal. Intradermal injections are shallow and often create a small bleb or wheal. Ear canal administration is otic. Swallowed medication is oral administration. Deep muscle injection is intramuscular. Question 63. The care team in a patient education session asks for guidance because a patient has a red allergy band on the wrist. Which action should occur before medication administration? Option A. Verify the allergy information in the record and with the patient. Option B. Give medication first and ask about allergies later. Option C. Remove the band so it does not worry the patient. Option D. Ignore the band if the patient seems healthy. The correct answer is option A. Verify the allergy information in the record and with the patient. Allergy alerts must be checked before medication administration to prevent reactions. Allergies must be checked before administration. Removing an alert without direction can create risk. Allergy risk is not based on appearance. Question 64. When a patient encounter unfolds in a busy front office, a waved glucose meter control result is outside the acceptable range. Which action is required before patient testing? Option A. Resolve the quality control problem according to protocol. Option B. Change the patient's diagnosis to match the meter. Option C. Record patient results without documenting controls. Option D. Use the meter because patient samples are different. The correct answer is option A. Resolve the quality control problem according to protocol. Out-of-range controls mean the system may not be reliable for patient results. Medical assistants do not diagnose and should not alter clinical information to fit a device. Quality control documentation is part of reliable testing. Failed controls must be addressed before reporting patient values. Question 65. In an electronic health record review, the office schedules several patients at the start of each hour and sees them as rooms open. Which scheduling method is being used? Option A. Prior authorization. Option B. Stream scheduling. Option C. Matrix blocking. Option D. Wave scheduling. The correct answer is option D. Wave scheduling. Wave scheduling brings patients in at set intervals such as the start of an hour. Prior authorization is payer approval and is not a scheduling method. Stream scheduling assigns patients specific individual appointment times. Matrix blocking reserves time unavailable for patient appointments. Question 66. When a patient encounter unfolds in a procedure setup, a patient questions a medication that looks different from the usual dose. Which response is safest? Option A. Document that the patient was difficult and continue. Option B. Tell the patient that questions are not allowed. Option C. Give the medication quickly before the patient refuses. Option D. Pause administration and verify the order and medication. The correct answer is option D. Pause administration and verify the order and medication. A patient concern can identify a potential medication error, so verification is required before proceeding. Labeling the patient does not resolve the possible medication issue. Patients should be encouraged to participate in safety. Rushing increases risk and ignores a safety concern. Question 67. An office review in a family practice clinic shows that the assistant removes gloves after contact with blood-contaminated gauze. Which action should follow immediately? Option A. Place the gloves in a regular drawer. Option B. Use the same gloves to clean the next room. Option C. Apply lotion instead of cleaning hands. Option D. Perform hand hygiene. The correct answer is option D. Perform hand hygiene. Hand hygiene after glove removal reduces the chance of transmitting microorganisms from contaminated gloves. Used gloves are contaminated waste and should be discarded properly. Gloves are task-specific and should not be reused between patients or areas. Lotion does not replace hand hygiene. Question 68. Given the workflow in a telephone triage workflow, the bladder of a blood pressure cuff is not centered over the brachial artery. Which issue may occur? Option A. The pulse oximeter will stop working. Option B. The patient will automatically faint. Option C. The reading may be inaccurate. Option D. The oral temperature will decrease. The correct answer is option C. The reading may be inaccurate. Proper cuff placement over the brachial artery is needed for accurate auscultation. Blood pressure cuff alignment does not control the pulse oximeter. Incorrect cuff placement can be uncomfortable but does not automatically cause syncope. Cuff placement does not change oral temperature. Question 69. When a patient encounter unfolds in a clinical skills review, the assistant scans a signed consent form into the wrong patient's chart. Which action is best? Option A. Leave it because both patients use the same clinic. Option B. Report and correct the filing error according to policy. Option C. Delete the form and tell no one. Option D. Ask the patient to sign a blank form. The correct answer is option B. Report and correct the filing error according to policy. Misfiled records can affect patient care and privacy, so they must be corrected properly. Clinic use does not make one patient's document appropriate in another chart. Unreported deletion can worsen the documentation error. Blank forms do not correct the misfiled record and are inappropriate. Question 70. At the start of care in a medical office workflow, a patient with known latex allergy is scheduled for a procedure. Which preparation is best? Option A. Use powdered latex gloves because they are easier to put on. Option B. Tell the patient to bring personal gloves only. Option C. Use latex-free supplies and clearly communicate the allergy. Option D. Ignore the allergy if the procedure is short. The correct answer is option C. Use latex-free supplies and clearly communicate the allergy. Avoiding latex exposure prevents allergic reactions and keeps the team aware of the risk. Latex gloves can trigger a reaction in a latex allergic patient. The clinic remains responsible for preparing a safe care environment. Even brief latex exposure can cause a serious reaction. Question 71. During an internal medicine office, the assistant reviews where bile is stored before release into the small intestine. Which organ stores bile? Option A. Gallbladder. Option B. Bladder. Option C. Pancreas. Option D. Spleen. The correct answer is option A. Gallbladder. The gallbladder stores and concentrates bile made by the liver. The urinary bladder stores urine, not bile. The pancreas produces digestive enzymes and hormones but does not store bile. The spleen is involved in immune and blood cell functions. Question 72. Given the workflow in an infection control audit, the provider is running behind and a patient asks for an update. Which response is professional? Option A. Discuss another patient's emergency as the reason. Option B. Apologize for the delay and provide the best available estimate. Option C. Tell the patient that waiting is their only option. Option D. Guarantee an exact time even when it is unknown. The correct answer is option B. Apologize for the delay and provide the best available estimate. Clear and courteous updates help manage expectations without blaming others. Sharing another patient's situation can violate privacy. Dismissive communication is unprofessional. False certainty can create more frustration. Question 73. The care team in a diagnostic testing area asks for guidance because a patient wants information released to a spouse. Which documentation is usually needed? Option A. No documentation because spouses always have full access. Option B. A verbal request from the spouse only. Option C. A valid authorization or permission according to office policy. Option D. A note written by the assistant after the fact. The correct answer is option C. A valid authorization or permission according to office policy. Disclosure to another person should follow privacy rules and documented patient permission. Relationship alone does not automatically grant full access to records. The spouse's request alone may not authorize release. Authorization should come from the patient or legal authority. Question 74. Before the visit continues in an electronic health record review, a patient is placed lying face down for a back examination. Which position is being used? Option A, prone. Option B, lithotomy. Option C, Fowler. Option D, supine. The correct answer is option A, prone. Prone means lying on the abdomen with the face downward. Lithotomy involves legs in stirrups for certain pelvic procedures. Fowler is a seated or semi-seated position. Supine means lying on the back. Question 75. As part of exam preparation in an internal medicine office, an electronic record uses an audit trail. What is its purpose? Option A, approve insurance claims instantly. Option B, sterilize instruments automatically. Option C, measure blood pressure. Option D, track who accessed or changed information. The correct answer is option D, track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Payer claims processing is separate from record audit logs. Audit trails do not process instruments. Vital sign measurement requires clinical equipment and technique. Question 76. At the start of care in an administrative check-in area, a 12-lead electrocardiogram shows wandering baseline artifact. Which cause is most likely? Option A, poor electrode contact or patient movement. Option B, a properly grounded machine with still patient. Option C, correct limb lead placement. Option D, a normal calibration mark only. The correct answer is option A, poor electrode contact or patient movement. Wandering baseline is commonly caused by motion, loose electrodes, or poor skin contact. Good grounding and stillness reduce electrical or motion artifact. Correct placement should reduce rather than create artifact. Calibration marks do not explain baseline movement during tracing. Question 77. During an electronic health record review, lead V1 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A, 5th intercostal space at the left midclavicular line. Option B, left arm below the clavicle. Option C, 4th intercostal space at the right sternal border. Option D, a 4th intercostal space at the left sternal border. The correct answer is option C, 4th intercostal space at the right sternal border. V1 belongs at the 4th intercostal space on the right side of the sternum. That location corresponds to V4 in standard placement. The left arm electrode is a limb lead site, not V1. That location corresponds to V2. Question 78. Following office protocol in a family practice clinic, a new patient calls to schedule an annual physical. Which information should be collected for registration? Option A, another patient's insurance card. Option B, demographics, contact information, insurance information, and reason for visit. Option C, only the patient's favorite pharmacy color. Option D, the assistant's diagnosis before the visit. The correct answer is option B, demographics, contact information, insurance information, and reason for visit. Complete registration information supports scheduling, billing, and clinical preparation. Insurance information must belong to the patient being registered. That information does not complete registration. The assistant should not diagnose during scheduling. Question 79. The care team in a clinical skills review asks for guidance because an adult patient declines a procedure after the provider explains the risks and benefits. Which principle is being respected? Option A, abandonment. Option B, patient autonomy. Option C, beneficence. Option D, respondeat superior. The correct answer is option B, patient autonomy. Autonomy means a competent patient has the right to make informed decisions about care. Abandonment involves ending care without proper notice or support. Beneficence means acting for the patient's good but does not override a competent refusal. Respondeat superior concerns employer responsibility for employee actions. Question 80. At the start of care in a patient intake station, the assistant must clean instruments before sterilization. Which concept explains this requirement? Option A, disinfection always destroys every spore. Option B, organic material can interfere with sterilization. Option C, packaging instruments makes cleaning unnecessary. Option D, sterilization is the same as hand washing. The correct answer is option B, organic material can interfere with sterilization. Cleaning removes debris so the sterilization process can contact instrument surfaces effectively. Disinfection reduces many organisms but does not reliably destroy all spores. Packaging dirty instruments traps contamination rather than preparing them safely. Hand washing reduces microbes on skin but is not instrument sterilization. Question 81. An office review in a cardiology practice shows that the nervous system is being reviewed. Which structure carries impulses away from the cell body of a neuron? Option A, ureter. Option B, platelet. Option C, alveolus. Option D, axon. The correct answer is option D, axon. An axon carries nerve impulses away from the neuron cell body. A ureter carries urine from kidney to bladder. A platelet is a blood component involved in clotting. An alveolus is a lung air sac. Question 82. Given the workflow in an exam room, a voicemail must be left for a patient according to office policy. Which message is safest? Option A, leave another patient's results for comparison. Option B, leave limited information and a callback number. Option C, demand payment details with full medical history. Option D, describe the diagnosis in detail on the message. The correct answer is option B, leave limited information and a callback number. Limited voicemail content reduces the risk of exposing health information to others. Sharing another patient's information is a privacy breach. Excessive information violates privacy and may not be necessary. Detailed clinical information may be heard by unauthorized people. Question 83. When a patient encounter unfolds in a family practice clinic, the provider asks the assistant to perform a task prohibited by state law. Which action is appropriate? Option A, clarify the concern and follow legal scope of practice requirements. Option B, ask another assistant to do it secretly. Option C, document that the patient requested it and proceed. Option D, perform it because any provider request is automatically legal. The correct answer is option A, clarify the concern and follow legal scope of practice requirements. Medical assistants must follow laws, regulations, and employer policy even when working under delegation. Passing on an improper task does not resolve the legal issue. Patient request does not override scope of practice limits. Delegation does not make a prohibited task legal. Question 84. The care team in a medication administration visit asks for guidance because a patient asks why a medication is placed under the tongue. Which route is being described? Option A, otic. Option B, topical. Option C, ophthalmic. Option D, sublingual. The correct answer is option D, sublingual. Sublingual administration places medication under the tongue for absorption through oral mucosa. Otic medications are placed in the ear. Topical medications are applied to the skin or surface tissues. Ophthalmic medications are used in the eye. Question 85. As part of exam preparation in a busy front office, a payer sends money with a remittance advice. What does the remittance advice explain? Option A, which vaccine lot is expired. Option B, how the claim was processed and paid or denied. Option C, how to sterilize forceps. Option D, where to place EKG chest leads. The correct answer is option B, how the claim was processed and paid or denied. Remittance advice provides payment, denial, adjustment, and reason information for claims. Vaccine inventory is not the purpose of remittance advice. Sterilization instructions are not part of remittance advice. Electrocardiogram placement is unrelated to insurance remittance. Question 86. A medical assistant is working in a treatment room when the term cardiology appears in a referral. Which specialty is involved? Option A, skin disorders. Option B, digestive disorders. Option C, kidney disorders. Option D, heart and cardiovascular system. The correct answer is option D, heart and cardiovascular system. Cardiology focuses on the heart and cardiovascular system. Dermatology focuses on the skin. Gastroenterology focuses on the digestive system. Nephrology focuses on the kidneys. Question 87. During an administrative check in area, a tickler file is used in the office. Which purpose does it serve? Option A, sterilize instruments. Option B, draw blood into tubes. Option C, track future follow-ups or reminders. Option D, measure oxygen saturation. The correct answer is option C, track future follow-ups or reminders. A tickler system helps staff remember time-sensitive tasks or future actions. Sterilization requires approved equipment and process. Blood collection uses phlebotomy supplies, not a reminder file. Oxygen saturation requires a pulse oximeter. Question 88. An office review in an electronic health record review shows that a patient requests an appointment reminder by text message. Which consideration is important? Option A. Text any diagnosis to any phone number in the chart. Option B. Ignore all reminder preferences. Option C. Post the reminder on social media. Option D. Follow office policy and patient communication preferences. The correct answer is option D. Follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Sensitive information and wrong numbers can create privacy risk. Preferences help guide appropriate communication. Public posting would expose private information. Question 89. To protect safety in a specialty referral visit, the term bradycardia appears in the chart. Which meaning should the medical assistant recognize? Option A. Fast breathing. Option B. Slow heart rate. Option C. High blood sugar. Option D. Inflammation of the liver. The correct answer is option B. Slow heart rate. The prefix brady means slow, and cardia refers to the heart. Fast breathing is tachypnea rather than bradycardia. High blood sugar is hyperglycemia. Inflammation of the liver is hepatitis. Question 90. The care team in a clinical skills review asks for guidance because the assistant documents a patient's statement in the medical record. Which entry is most appropriate? Option A. Patient states, I have had a cough for 3 days. Option B. The assistant diagnoses pneumonia. Option C. No documentation is needed for symptoms. Option D. Patient is definitely exaggerating the cough. The correct answer is option A. Patient states, I have had a cough for 3 days. Quoting or clearly attributing patient statements helps distinguish subjective information from clinical findings. Diagnosis belongs to the provider. Symptoms are relevant to the visit and should be documented according to policy. Judgmental wording is inappropriate and not objective. Question 91. After reviewing the situation in a patient intake station, the term tachypnea appears on an intake form. Which meaning is correct? Option A. Painful urination. Option B. Low temperature. Option C. Rapid breathing. Option D. Slow pulse. The correct answer is option C. Rapid breathing. Tachy means fast, and nea relates to breathing. Painful urination is dysuria. Low temperature is hypothermia. Slow pulse is bradycardia. Question 92. For a patient encounter in a medical office workflow, a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A. Ask the patient to jump to the table. Option B. Lock the wheelchair and use proper body mechanics with assistance as needed. Option C. Leave the wheelchair unlocked for easier movement. Option D. Pull the patient by the arms quickly. The correct answer is option B. Lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. Jumping is unsafe and unrealistic for a transfer. An unlocked wheelchair can roll and cause a fall. Pulling can injure the patient and the assistant. Question 93. After reviewing the situation in a quality control review, the assistant prepares a vaccine that must remain refrigerated. Which practice is safest? Option A. Maintain required temperature storage and check expiration before use. Option B. Use it after expiration if it looks clear. Option C. Store it in a desk drawer overnight. Option D. Place it in direct sunlight to warm quickly. The correct answer is option A. Maintain required temperature storage and check expiration before use. Vaccines and temperature-sensitive medications require proper storage to preserve effectiveness. Appearance does not prove potency after expiration. Room temperature storage can damage refrigerated products. Sunlight and heat can damage the product. Question 94. Before the visit continues in an internal medicine office, an insurance plan requires approval before a specialist visit. Which process is being described? Option A. Auscultation. Option B. Prior authorization or referral process. Option C. Autoclaving. Option D. Venipuncture. The correct answer is option B. Prior authorization or referral process. Some plans require authorization or referral before certain services are covered. Auscultation is listening to body sounds and does not approve visits. Autoclaving sterilizes instruments and is unrelated to payer approval. Venipuncture is blood collection and does not authorize insurance coverage. Question 95. At the start of care in a pediatric clinic, the assistant reinforces instructions for a Holter monitor. Which point is important? Option A. Submerge the monitor in water. Option B. Keep a diary of symptoms and activities as instructed. Option C. Remove electrodes whenever symptoms occur. Option D. Ignore the return time. The correct answer is option B. Keep a diary of symptoms and activities as instructed. A symptom and activity diary helps correlate events with the recorded rhythm. Water can damage the device and create safety risks. Removing electrodes can interrupt recording when data are most important. The monitor must be returned as scheduled for data review. Question 96. To protect safety in a patient education session, a patient has been drinking hot coffee immediately before an oral temperature. Which action should the medical assistant take? Option A. Switch to a rectal temperature without asking. Option B. Record the temperature as normal without measuring it. Option C. Wait according to office protocol before measuring the oral temperature. Option D. Take the temperature immediately because oral readings are unaffected. The correct answer is option C. Wait according to office protocol before measuring the oral temperature. Hot or cold intake can temporarily alter oral temperature and lead to an inaccurate reading. Changing to an invasive route requires proper indication and protocol. Vital signs must be measured rather than assumed. Recent liquids can affect oral temperature results. Question 97. A medical assistant is working in a same-day appointment when a patient asks which body system includes the skin. Which system should be identified? Option A. Integumentary system. Option B. Urinary system. Option C. Respiratory system. Option D. Endocrine system. The correct answer is option A. Integumentary system. The integumentary system includes the skin, hair, nails, and related glands. The urinary system filters blood and eliminates urine. The respiratory system supports breathing and gas exchange. The endocrine system is made of hormone-producing glands. Question 98. The care team in an administrative check-in area asks for guidance because a provider orders a medication using an abbreviation on the unsafe abbreviation list. Which action should the medical assistant take? Option A. Ignore the medication order completely without communication. Option B. Ask another patient what the abbreviation means. Option C. Clarify the order before proceeding. Option D. Interpret the abbreviation however it seems most likely. The correct answer is option C. Clarify the order before proceeding. Unsafe or unclear medication orders must be clarified to prevent misinterpretation. The order should be clarified rather than silently ignored. Patients are not appropriate sources for interpreting orders. Guessing can lead to serious medication errors. Question 99. When a patient encounter unfolds in an urgent care office, a minor arrives without a parent for a non-urgent visit. Which action is best? Option A. Follow state law and office policy for consent requirements. Option B. Ask another patient in the waiting room to consent. Option C. Assume all minors can consent to every service. Option D. Refuse all care without considering exceptions. The correct answer is option A. Follow state law and office policy for consent requirements. Consent rules for minors vary by situation and jurisdiction, so policy must be followed. Other patients cannot provide consent for the minor. Minor consent is not universal for all services. Some laws allow minors to consent for certain services. Question 100. The care team in a preventive care visit asks for guidance because a patient needs crutch walking education after provider instruction. Which principle is important? Option A. The patient should skip follow-up if pain increases. Option B. Crutches should fit properly and not press into the axilla. Option C. Body weight should rest mainly on the armpits. Option D. Crutches should be used only on wet floors. The correct answer is option B. Crutches should fit properly and not press into the axilla. Improper crutch fit can compress nerves and blood vessels in the axilla. Worsening symptoms should be reported according to instructions. Weight should be supported through the hands, not the axilla. Crutches are mobility aids and wet floors increase fall risk.